Over the last 6 months, I have not touched or spent any of the money that I have been paid as a physician. What's up, guys? This is Dr. Antonio Webb. Thank you for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. So, for those that are new to the channel, welcome. My name is Dr. Antonio Webb, an orthopedic spine surgeon. I am about 6 months out of training, 6 months into practice. How has the last 6 months been? Well, it's been a great time. This is certainly a time where you get to build your own and to do things that have always kind of been under someone else's kind of terms. When I get talks to students, I tell them as a medical student, pre-med student, resident, fellow, you're going to be expected to be somewhere at a certain time where they tell you to be there, how long you will be there, and exactly what you will be doing while you're there. So you lose a lot of control over your entire life in your training, and sometimes that may be 10 plus years. For me, it was 10 years of my life. Someone told me what time to be somewhere, what we were going to do while we were there, and then how long we would be there. So some shifts I would work 30 plus hours. I didn't have much control in that. But now that I'm out in practice, nobody can tell me what to do. And I have so much more control over my schedule. This will depend on what type of practice that you're in. Private practice, you have a lot more flexibility, a lot more autonomy in terms of what you can and cannot do and what you should be doing. There are some private groups that you join, depending on your specialty and type of practice, that you may not have much autonomy or you may not have much say-so in terms of what you're doing and flexibility in your schedule and those things. They will push you to produce. Say you got to work this many hours, you got to see this many patients. So there are some groups that are that way, that's very group dependent. Also, when it comes to taking call, there are some surgeons that come out of practice or some physicians that come out of practice that don't take any call whatsoever. There are other groups that make you take call, whether that's like a general, like if you're an ENT surgeon, you take some, if you're a pediatric ENT surgeon, you may take some general ENT call, and some groups require that. So every group is every group is so different, vastly different, and you have to determine like what groups or what hospital or what academic center kind of fits you and makes the best opportunities for you and your family. So, the three main groups, as I talked about before: private practice, employed positions, which means you're hired by a hospital or some type of corporation, or academic, which means you work at an institution or a university, teaching residents, medical students, doing research and all those things. So there's pros and cons to all three different types of practice models, and you have to figure out what works best for you. Well, for the last 6 months, it's been great. I've been able to make my own schedule. If I see patients in office and I only wanted to start at 10 o'clock in the morning, I can certainly do that. No one can really tell me, hey, you need to be seeing patients by 7 a.m. in my particular group, or you need to see 30 patients today. Well, that has been one of the biggest things I have really enjoyed in terms of making my schedule and being very flexible in terms of my schedule. So once you do get out into practice and you finish your training, you have to build your practice. I have another video where I talk a little bit about that, but I'll put that right up here. But you need to be able to let people know that you're new and you are accepting patients and you're ready to build your practice. Some people, some groups, you take call, and that call helps you to build your practice, because if you take call right away and the emergency room calls you with, let's say, 7 patients per day for, if you take it for 1 week at a time, that can build your practice really quickly. So other things that you have to do once you're out into practice to kind of get the word out, you need to let people know that you're new provider in town, and you're accepting patients. So one of the things you have to do is you have to go knock on doors. You have to introduce yourself to the people. You have to let them know that you're a new provider in town. One way of doing this is actually just going door to door. I've knocked on doors of primary care offices, chiropractors' offices, physiatrists, pain doctors, other specialists, just to say, hello, I'm Dr. Webb, new spine surgeon in town. I'm just coming by to meet you, to introduce myself, and I hand out my business card or some referral pads. That's the way you build your practice. With social media these days, you can supplement that. You'll have patients that may find out about you if you have a social media presence. But by far, and the king of building your practice is word of mouth. Having patients that you've seen, that you've treated, and they like you as a physician, as a surgeon, you may have operated on them. They tell their brother, sister, uncle, cousin, the word gets around. So that's by far the best way to build your practice. But social media can certainly supplement that. I've had lots of patients that have flown in to see me, which is really crazy that people will fly in to see me as patients from California, from Kansas to Louisiana. I had a patient fly in. So patients will definitely travel to see you if they certainly think that you can provide them really good care. So social media is helpful, knocking on doors, giving talks. You basically have to get the word out that you're in town. And especially if you're in a city or a town that you're new to. So nobody really knows who you are. So in order for them to start sending you patients and giving you those referrals, they have to trust you. So it's all about rebuilding that rapport and that trust with referring providers and rest people that are in the community. So for me, I've given lots of talks to different groups, practices, just introducing myself, and I may give a lecture on some orthopedic or spine surgery topic. And some people give talks to nursing homes, to various organizations to get your name out there. So that's one of the things, some of the things that I have been doing to kind of build my practice. And some groups that you go to, you may show up. When you're joining that group, you may not have anybody in your clinic that first day. You have to get people to come to see you. My first clinic, I had a few patients, not that many. Now my clinics are 20 patients in my office each clinic day, sometimes 25 patients, which is crazy because it's grown over the last 6 months, and hopefully I'll grow that even more over the next 6 months and kind of beyond. So, these are things that you have to do as a doctor, as a physician, as a surgeon, and it depends on your practice. Some practices, you may get there, they may have 30 patients waiting on you. Like one of my co-fellows who his first week of practice, he had surgery scheduled, he had patients already waiting to see him. We graduated on a Friday, he had a clinic set up on a Monday, like a full clinic in a practice that didn't have a spine surgeon. So if you go to a group like that, they may have patients waiting on you. Most other people, you have to build your practice over time. So that's one of the things you have to do, and that's what I've seen over the last 6 months. So another thing that I've learned over the last 6 months is that you can't fix or help everyone. So you leave training with all this knowledge, with all this experience, and you want to go out and save the world. So, as a new attending, you're going from a very busy time as a trainee, and you may go out into practice and you're not that busy because you got to build up your practice. You may only have a few patients in clinic, your first few clinics. My first clinic, I had like 3 or 4 patients in my office. Now my clinics are 20, 25 patients in my clinics, it takes time to build that. But what I've learned is that, and I talk to a lot of my senior mentors and senior partners in my group, that you can't help everyone surgically. You may be able to help them in other ways, physical therapy, some conservative measures, but I do see a lot of complex patients that have lots of comorbidities. They may have heart disease, kidney disease, on all these different medications. They may have some, medications that may not be the best interest of the patient to be taken during surgery, like medications that lower your immune response. So these are things that you have to pick up and you have to learn as a surgeon or as a physician when you're treating patients. Usually I can tell within the first few minutes of reviewing a patient's history and just looking at them and doing an examination of whether that patient will be a good surgical candidate or not. So that's something that it takes time. It takes years to develop that intuition of which patients would be good surgical candidates. And as a surgeon, you don't want to operate on every single one because you have to look at the risk benefit kind of profile and figure out which patients will have good outcomes in your hands and the things that you can do as a surgeon. And other physicians, whether you're primary care or OBGYN, nephrology, I'm pretty sure they have a similar mindset as well, but maybe not as stringent as a surgeon because, there's a lot of things that can go wrong, especially in spine surgery. So even though well-trained, 14 plus years of my life been in training, you can't help everyone. So another thing I've realized and learned over the last 6 months is that, really reinforced is that you have to live within your means. Coming out of training as a resident or a fellow, you will get paid $60,000, $70,000. Sometimes as a chief resident, you may get paid $80,000, depending on what duties you have, how much extra call that you're taking, whether you're moonlighting, etc. But when you become an attending or once you're out in practice, your income is going to go up 6 times, 7 times, sometimes 8 times as much as you were making as a trainee. So sometimes it may be 10 times as much. So what's most important is that how you deal, how you respond to all that income when it comes in. So you don't want to go out and blow your money your first few paychecks or go buy these very expensive houses, things that you may not be able to afford later on. So I've always been told to live like a resident your first few years out of training so that later you don't have to live like a resident. So that first few 6 months or a year out of training, just pay yourself extra. If you're getting paid $75,000 as a resident or a fellow, pay yourself $100,000 or $110,000. That's still a lot of money that for most people in America and other countries as well. So it's not like you're living kind of on beans and rice, which some people argue that you should, like Dave Ramsey talks about. But just give yourself a little raise, save the rest, invest it, pay off your student loans, be very aggressive about that. I have a video about that. I'll put it right up here. But those first few years out of practice, how you respond and how you react to that income is going to be very critical in terms of your financial and your key to getting out of debt and staying and being financially free. So that's something I'm very passionate about. Over the last 6 months, I have not touched or spent any of the money that I have been paid as a physician. There are other things that I do, businesses and some consulting talks that I give, but I use that to live on. But none of the money that I have spent, that I have been earned or paid as a physician, as a surgeon, I have not touched. I still have all of that money. So in 6 months. So I recommend that you do the same. Just live very frugally, live within your means. Don't try to keep up with the Joneses. It's very tempting to, just say, hey man, I've been in training for 14, 15 years of my life. I'm about to go get me a Bentley or a Porsche or a new house. So you could do those things, certainly. And every case is different. Everybody's a little bit different. What works for me and my family may not work for you. So I know people, have friends who bought a Bentley and a Porsche soon as they finished their training. That's okay. So, everybody's a little bit different. I may turn around and go buy me a Porsche tomorrow or some type of a G-Wagon. I don't know. So it depends. Every situation is a little bit different, and you just do what's best for you and your family. So another thing that I have learned over the last 6 months is that it's okay to say no. They're going to be, as a new person in the group or a new person in the practice, new person out of training, you're going to get hit with a lot of different things from different angles in terms of patients, very complex patients, things that you should not be probably doing fresh out of training. You have to realize that everybody's watching you when you're out in training. You're a new surgeon or new doctor. Everyone wants to see how you're going to, how good of a doctor you're going to be. So if you're doing very complex surgeries, that's okay to take on, but you have to understand what you're willing to take on and what you're willing to risk. Because if you have a complication right out of training, that can be very detrimental for a lot of surgeons. And I'm speaking specifically to the people that are interested in surgery or the surgery residents. Those first few months, a year out of training, be very selective in terms of what cases you take on. You don't have to take on every single complex case. I've been told, my mentors have stressed the importance of go for the home runs, cases that you know the patient will have a good, successful outcome, and you don't want to be doing these 14, 15-hour complex cases 2 months or 3 months out of practice. So just make sure you remember that. So those are the things that I have learned over the last 6 months. This is how my last 6 months has gone. You know, it's been crazy experience, starting off in practice in the middle of a pandemic. You know, when you're trying to go out and meet people, meet referring providers, knock on doors and introduce yourself, and then, everyone's in a mask and no one wants to let you in their office to meet them. And then, you have patients that they may be hesitant or a little bit, reserved about coming to your office or about having surgery because of everything that's going on. So it's been definitely my practice start has been impacted by COVID, but we're making the best out of it. Certainly doing all those things that I discussed in terms of things that you have to do to build your practice, and just hoping for the best. The next 6 months is going to be even better than the first 6 months. But it's been a blast over the last 6 months being out in training, and it's way better than being a trainee. There's definitely light at the end of the tunnel. So for people that are pre-med students, if you're sitting there, you're studying, like, man, I don't know, I hate this, I don't want to go through this. This is a long time. Trust me, each year should get better. There's certainly light at the end of the tunnel, and you'll reap the rewards of all your hard labor. So just keep going. This is Dr. Webb. Thank you for watching this video, and we'll see you next time.